after a while, the battle will be over. For that day when we shall lay down our burden and study war no more. Finally, brethren, after a while, the battle will be over. For that day when we shall lay down our burden and study war no more.
You know, because with my particular situation, the people that are supposed to care, you know, primary care physicians, psychiatrists, psychologists, they don't. So why should anybody else? I mean, I hate to say it, but it's just wasted breath. You know, I have a psychiatrist and a psychologist who I meet with once a week, and that does really well. But, you know, I don't even tell them about suicidal thoughts because just even having the thoughts, it makes you angry at yourself. And then because you're angry at yourself, you want to hurt yourself. So it's a pretty vicious cycle.
Lots of people come back debilitated, psychologically damaged by their continual participation. And the more you go back, people going back for second tours and third tours escalates the likelihood that they're going to come back with some trauma. The body responds in certain ways if it is disturbed. And sometimes the biochemistry changes. And there are some people who may do well with medication. It's just that there's a dramatic overemphasis on the medication, which is stealing from both individuals and the patients themselves an opportunity to find alternatives.
Some of the first stages of post-traumatic stress were sinking in halfway through the deployment. To try to explain that and put it into words, it'd be like I'd have to pull you out of your comfort zone as a civilian and take your entire life and rearrange it and put you behind, you know, the barrel of a 50 caliber machine gun and, you know, have you shoot into neighborhoods, you know, having roadside bombs blow up on you, missiles and rockets being shot at you. I mean, to take all that and then try to say, okay, now you come back to your comfort level and tell me how that was. It's like living in a haze. There's a lot of days where I have to like drag myself out of bed. I don't discount any healing mechanism. I don't discount any remedy. It really depends on the individual. You know, I found that activity has kept me, you know, pretty straight and narrow. I feel that I am meditating when I'm fly fishing by myself and I'm in the water and connecting to nature. Whether it's, you know, music or hiking or mountain biking or camping or fishing, it's important that you don't let that negativity drag you down. A huge factor in why maybe a lot of veterans aren't finding solutions with their post-traumatic stress disorders, nobody's listening to them. I'm very lucky that I've had individuals that have listened to me.
Nowadays, we hardly even talk to people, typing in notes into computers while talking to the patient and occasionally looking in their direction. It's being able to connect in a caring, open-hearted way with another human being who is going to listen to your experience and who has some knowledge and awareness of who you are, where it is you come from, and is willing to take the risk to confront you with the choices that you want to make and help you find a path to get to the goal that you've set for yourself.
Just recently, my physician at the VA told me that my goal to be 100% pain-free and is an unrealistic goal. He said he said for me and my particular issues, that's not going to happen. And you know, if having a physician tell you that can be pretty depressing. So when you have a physician that tells you you're never going to be pain-free, and the only thing that's worked for you so far is medication, the future looks pretty bleak.
Afghanistan 2012, your thoughts. Feel free to cut loose.
Cut loose?
Yeah.
Biggest waste of my life. And time.
For some fucking reason, I thought I was gonna go over there. It was gonna be fun. And I was gonna make a lot of money and come back, and everything was gonna be fine. And that's not how it was. It was the total fucking opposite. Anxiety, depression, suicidal thoughts, suicidal ideation. There are nightmares about Afghanistan, or sometimes getting attacked, like someone's trying to kill me. The best way I've figured out how to deal with it all is to just not deal with it at all, and to stuff it in and hold it in.
I think we realize that we just need some more resources. You know, that the model of care has evolved into, we need to look at the whole person. And in order to do that, we need more choices, we need more aspects of care that, you know, maybe 10, 20, 30 years ago seemed a little out there or not well researched. But the research is showing that this is beneficial, and with the way things are going, we can do a lot of good for our patients without medication.
We're trying to kind of look at lots of novel interventions, different ways that we can help people perhaps increase resiliency or, you know, cope with stress or deal with suicidal crises. So really thinking about kind of the continuum of that pathway from long before anything happens to once people are kind of closer or have just had an event. And the hope is to find novel ways. Now that's why we're doing the research, is we don't know.
My first deployment ended in the summer of 2006. Couldn't sleep, anxiety, depression, and I did what everybody else did. I took all the pills that I was given. And I did that for quite a while, like maybe 3 or 4 years. And it was on my second deployment that I said, you know, I don't want to come home and experience the same things that I experienced last time. And that's when I actually ended up moving to Sedona and started, you know, really dedicating myself to my practice. I connected with nature. I hiked on these beautiful red rocks. I came and practiced yoga here at the 7 centers and really focused on my internal self.
I remember Sherry coming here on a personal retreat, but she didn't know why she was here. She thought she was coming to Sedona for massage and hiking and a little bit of yoga maybe, but she didn't have a clue what was waiting for her, I don't think.
What yoga has enabled me to do is find the ability from internally, the way to quiet the mind, to sit quietly, to observe, to not react, without the prescription medication. And when you can do that, you don't have that feeling of fogginess. You don't have that feeling of like the hangover feeling of what just happened.
Yogic practices, posture practice, breathing practice, meditation can help regulate imbalances in the nervous system that are associated with the experience of anxiety and depression. We're studying in an empirical way the delivery of this yoga-based intervention. And so we have a very standardized way that we deliver the intervention each time. For anything to be disseminated at the national level, you first have to have some really good empirical research that says this is the impact that we see that we're having.
It just has to get through the bureaucracy to do it, you know, to get to the point where someone says, yeah, why don't you come and teach a class? Or yeah, let's have a class. And it just would prove itself. I mean, I don't see anything harmful that can happen through yoga.
Then I get into a rhythm, then it goes da, 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 da. I guess that's why they play that super rhythm. When I first came into this program, I was looking for that happy magic pill, you know, the thing that's going to just make all my troubles go away. This is not that. This is working to find out what the real problem is, and then you dig a little bit deeper. And once you find that, that's what you focus on. It's distracting me, but it's also keeping me in sync with, that's one of the things the Army teaches you, is before you go into a room, you have to all be in sync. So you know what the other one's gonna do without a shadow of a doubt. Even though there's all kinds of fear and hesitation, you know that that person's doing what they're supposed to be doing, just like this. For me, I never wanted to talk about my problems because it was easier to go, I'm gonna put it behind me. This program makes you talk about them. It forces you to talk about them. And believe it or not, it actually helped me. It helped me to deal with it.
They'll have neurofeedback or biofeedback at least once a week and usually multiple times in a week. They'll have a movement therapy, which would be Tai Chi, yoga, Qigong, meditation. If we have a group that's got a lot of energy, they sometimes will do juggling, which is a way to kind of get focused. They'll do a meditation practice together. You know, I don't think we need to eliminate standard Western medical treatments. I think there's things that, you know, obviously, you know, penicillin has its place, but I've seen so many that end up with multiple medications and minimal benefit. When you have those alternatives, if you aren't considering them along with others, you could end up with a lot of missed opportunities and lost lives in many cases.
You mask it as far as you can until it breaks you. And when it breaks you, that's when you need to get help.
Since I've been going to this acupuncture clinic, I have had to use my anxiety meds a couple of times. I was going down a bad path, and I just like this, I don't know if you want to call it inner spirit or something, just was like, this isn't cutting it. I was waiting on the VA, and it's like, yeah, if that comes through, that's great, but I, as a person, have to do something.
Most often they're very receptive. It's just a matter of giving them a little explanation of what the treatment can possibly do for them. And oftentimes vets have been through the Veterans Administration system and other systems, and they're oftentimes overly medicated and heavily medicated. They've turned to drugs and alcohol and things like that, and many of them are seeking other ways to help themselves.
3-4 months ago, I was in a slump, and I was just in a bad place. I had this huge beard and looked like one of the Geico cavemen, and I snapped myself out of it and came in here, and they're like, "What are you doing?" And it's like, I'm not waiting on this anymore. I have to make a change.
So I think it's becoming more and more mainstream, and I would say probably in the next 5 or 10 years it's going to be just part of regular treatment. It's very personal, and they get a lot of personal attention, and they're not just a number, and they're not just an ID number or a tag number.
Trying to describe PTSD to somebody that doesn't have it is kind of like describing blue to somebody that's blind. It's so many different things that happen at once. I mean, you can feel your body temperature kind of rising, your anxiety levels going up. And like, I'm a very social and outgoing kind of person, and it will literally make it to where like I'll pull the blinds, don't talk to anybody, don't return anybody's calls, because my anxiety is just so high. I just started using marijuana, and it just was helping me along, and I realized that it was helping me a lot more than any kind of prescription medication really was.
When you think about Big Pharma, probably Big Pharma has the biggest stake in suppressing marijuana research because they don't want whole plant botanical medicine to ever compete with their pills.
When I was going to see one of the psychiatrists I was seeing, who really wasn't helping me at all, he was the one who was prescribing me 6 milligrams of Xanax a day, 4 milligrams of Klonopin, 20 to 30 milligrams of Adderall, and then the Trazodone at night to help me sleep.
The real question here is if the vets are demanding access to marijuana and demanding science and research to understand how marijuana works, why isn't the government listening to these people that have put their lives on the line? I don't think any vets have any realistic hope that the VA is going to come around anytime soon, so they're going to figure out how to manage their symptoms in the best way they can.
I filed for my disability benefits a year and a half ago, and they're just so backed up right now with everybody that's gotten out. Hopefully the process will be done in the near future, but I'm not holding my breath.
They deserve better. They know that they should be treated with the utmost respect and with the utmost dedication to finding solutions to PTSD. And they see that the government is lagging, that they're dragging their feet. And the truth is that anytime you dare to ask the government to allow you to do a study on the efficacy of marijuana, it's going to get blocked. Science should never be shackled by politics.
Well, I play the guitar poorly. I do not claim to be a very good guitar player at all. I still love to do it. Music, honestly, I can say that music has helped me just as much as marijuana or therapy or anything else has had any kind of impact on my life regarding my PTSD. Music is my therapy. Just going and hanging out with my friends, playing, it just speaks to my soul, and I love it.
If the VA is not responsive, there's got to be some kind of alternatives. We need to expand those alternatives. And the VA can be instrumental in expanding those options. And certainly when we're dealing with mental illness, it is the spirit that becomes darkened. It's like putting lampshades over the light of one's spirit. And by spirit, I don't mean some belief in a great spirit. I'm talking about that ineffable quality within, that light inside, that propels us forward in the hard times. And what we ought to do in healing relationships is help people rekindle that light that often gets covered by all kinds of lampshades of fear and doubt and other symptomatic stuff. We need to help people get rid of that lampshade so that they dare to imagine that they can once again see in the dark,